Joining us this morning to give us an update on conditions at San Juan Regional Medical Center, Jeff Bourgeois is standing by from the hospital. Mr. Bourgeois, good morning. Happy New Year.
Good morning, Scott and Megan. Happy New Year to the both of you.
Thank you very much. And let us know how things are faring here at the hospital this week. What are the latest numbers that you can share with us this morning?
Okay. Well, these numbers that I'm sharing are as of Wednesday morning, January 13th. We continue to see a very high census, a total of 177 patients in-house as of this Wednesday morning. 79 of those are positive COVID patients. We have another 17 that are under investigation pending test results, and a few other respiratory type diagnoses for a total respiratory force census of 89. So very, very busy hospital. We have also noticed that the acuity of illness of our patients is really at an all-time high. That is consistent with what other hospitals in the state are reporting now, both for COVID and non-COVID related diagnoses. So it's a very, very busy time in terms of just overall number of inpatients as well as the acuity of their illness that we're seeing. What I can tell you also is that on our positivity rate, as I look at our 14 and 7-day rolling average of positivity for results for tests taken at the hospital. Again, this is not countywide numbers, just those tests that we are responsible for completing. It's still very high. The 7-day rate has dropped down to about 20%. And I say dropped down to 20%. 20% is still awfully high against the state's target of 5%. And our 14-day rate is still right around 25%. So still a high level of disease presence in our community, particularly among the patients that we're seeing, obviously. On the vaccination front, I'm happy to report that we have about a total of 50% of our employees fully vaccinated now, and we've continued to work with other agencies and healthcare providers to provide vaccinations to them. So sheriff's department, state police, local police department, fire department, physicians and physician office personnel, and also essential workers who are unable to work from home. We've been vaccinating all of those different agencies and those types of employees. If you have a listener that believes they are an essential worker who is unable to work from home and would like to get a vaccine, they are to go through their supervisors to coordinate a schedule with us at the hospital, and supervisors and our team will make sure that they have the proper consents available. Community-wide vaccinations are going to be handled here locally through a collaborative effort of the county and the Department of Health. We will, at San Juan Regional, of course, cooperate in however we are asked to do so, but they are taking the lead in coordinating our community-wide vaccine approach. So in the meantime, I would encourage all your listeners who are interested in receiving the vaccine to go ahead and get registered. And if they could do that by going to vaccinenm.org, that will take you to the state's vaccine registration site to go ahead and get your information recorded and get people in the queue for vaccinations when they do become available. And then one other question that we're starting to see is that from people who received their second dose of vaccination, do they need to quarantine after travel or after suspected exposure to a positive individual? And current CDC recommendations have not changed in the post-vaccine environment as of yet. And so what that means is, yes, we still recommend following CDC guidelines and quarantining after travel or after suspected exposure, even if you've been fully vaccinated. That may change as more data becomes available, but I think CDC is taking an evidence-based and a cautious approach to changing the recommendations if they do so. So right now, as I said, their recommendations are to continue the practice of quarantining after travel or possible exposure. And of course, along with that goes all the other social distancing, masking, washing hands, etc. Recommendations that have been in place for so long now.
Very good. Thank you. Megan, you have a question?
Yes, just I have a couple of questions, and the first one is just you had mentioned sort of a more healthcare technical term back when you were reporting about patients in the hospital, and you mentioned the rate of acuity being higher. So for listeners who are more unfamiliar with the lingo there, what does that mean?
Okay, that means how sick they are, the critical nature of their specific condition that causes them to be in the hospital. So the sicker they are, we would say the higher their acuity is.
Right, gotcha. And the follow-up is in regards to the vaccine with 50% of employees being vaccinated. Have they gotten the complete round? We know that these are two vaccines are needed to complete that round. Have they gotten their second one yet?
Many have, and some haven't. And it's due to the schedule of when they got their first one. So, for example, tonight I'm scheduled to receive my second dose. Again, this being Wednesday, and we have others coming online now to get their first dose.
Got it. Very good. And Megan, you have a follow-up?
I do. Well, it's actually a slight change in direction, but I believe at one point we might have talked about having to double up rooms. We already talked about how we've had to convert certain floors to COVID floors. Are we putting 2 patients per room now? I mean, one of the great things about San Juan Regional was that there was always, people had their individual rooms, and that's actually outstanding compared to a lot of hospitals in the nation. But given the rate of hospitalizations, are we putting 2 per room, or how's that looking?
We have done that, Megan, but really on very limited circumstances. And most of that has been when there are members of the same family hospitalized, that we've been able to allow them to share rooms. That's actually oftentimes viewed favorably.
Sure. Interesting.
But we have had those occasions just due to number of beds available that we have had to go to semi-privates on. It's the exception rather than the rule, I would say, just because of how our patient rooms are structured.
Right, that makes sense, Jeff Bourgeois. But I guess it certainly gives you a little bit of expansion room if you need it to house additional patients, even if they're within the same family. I wanted to ask you a little bit about the numbers. You said that numbers are still high. They're at the hospital, of course. We have seen, at least in recent days, some of the numbers coming down just a bit. Are those numbers that you're watching to maybe predict what your numbers are going to be maybe a week from now or in the next couple of weeks? Are you kind of watching those state numbers that are reported every day?
We are every day. The hospitalization statewide is still over 700, and that's off from the peak, but it's not dropping precipitously. In fact, today there's just a few more than there was yesterday, about a dozen or so. So it's there's typically a 2 to 14 day, there's a wide range, a 2 to 14 day incubation period from when you're exposed to when you might begin showing symptoms. And then there's if someone is going to get sick enough to be hospitalized, there could be even more time. So, being that this is only the 13th of January, if there was going to be a spike from holiday-related, specifically Christmas and New Year's gatherings, we could still see some increase from those here in the next 2 weeks, I would estimate.
Sure.
We haven't seen a softening of our census really as of yet. This is still a very, very busy time.
Right. Understood. And one final question from me, at least, Jeff Bourgeois, before we let you go this morning, and that is back to the vaccines. We have heard other states may be struggling with getting the vaccines kind of into the arms of those that need them. You mentioned 50% of your staff has now had the vaccine, some having the second dose. And also, can you give us an idea as a healthcare professional, kind of how our state is faring compared to others? It seems like the rollout has been fairly smooth. And as long as the doses keep coming in, the state seems to have a system in place to get them into the arms of these frontline workers, these nursing home residents, these caregivers, and the others, according to that phased plan that we've been seeing. We're now in phase 1B, I think, of the vaccination rollout, correct? Are we doing, I guess my short question is, how are we doing?
Yeah, I think the state of New Mexico in general is doing very well. This is a big project, as you can imagine, to logistically coordinate. I heard a report earlier today that in Albuquerque, there's going to be vaccinations being delivered at the University of New Mexico basketball arena, the pit. And so, there's every community is going to be a little different in the logistically on the locations that they have available to provide the vaccines. And as I mentioned, we're going to collaborate with the Department of Health in our county here locally in whatever way they ask us to assist in the more widespread vaccination to our general community once that is available.
Great. And I have one final question for you, because I always like to get an update as it pertains to elective surgeries and other routine health screenings, x-rays, routine procedures, etc. What is the update on how those are going? Are we doing elective surgeries again? Are we putting them on hold for a bit?
Let's take the second part of that question first, if I could, Megan. So routine health screenings and diagnostic testing and things that your physician would recommend, we strongly encourage that you do not delay those. We believe that a delay in that type of work over the past year it's what's leading to the higher acuity in hospitals across the state right now. So if your physician feels you need any type of diagnostic workup, we strongly encourage you to follow their recommendations. And with respect to surgeries, I believe I've been out of pocket for a little bit here, but I believe the state had a public health order that expired January 4th and has now been extended. I need to confirm that, but I believe that still limits elective surgeries. So we still have a team of surgeons and anesthesiologists that meet every day to review our surgery schedule to make sure that those cases are necessary. The motive behind that, as you can well imagine, is to make sure that we keep every bed available for the COVID patients that are continuing to present to our hospital.
That makes sense, Jeff Bourgeois. It kind of also goes in, I think, with what Dr. Underwood told us recently, too, was that maybe if a surgery could be done and the patient doesn't have to stay overnight at the hospital, they could go home to recover, that maybe some of those were still able to be performed.
Yeah, they are, and that's, again, reviewed on a case-by-case basis. So I think the team of surgeons and doctors that we have looking at that are doing great work to make sure patients who need surgery are getting it, and also conserve our hospital beds as much as possible.
Sure, of course. Well, Jeff Bourgeois, again, we always appreciate speaking with you to get an update on the conditions at the hospital and also to allow us to pass through you our sincere thanks to all the folks working on the front lines there at San Juan Regional Medical Center to keep us all safe and well. Thank you for joining us this morning.
My pleasure. Thank you both, Scott and Mike.